guys, welcome back to the D&N Medical Series. In today's video we're going to look on schizophrenia. So what is schizophrenia? Schizophrenia is a chronic mental disorder that affects chemicals in your brain. So there's an imbalance of chemicals, and that can affect the way you think, the way you talk, and the way you behave. So what is the prevalence rate of schizophrenia? Now, schizophrenia affects about 1% of the population, which is about 1 in 100, but recent incidence is about 1.5 per 10,000 people. So what are some causes of schizophrenia? Well, there's no exact cause of schizophrenia. It is thought that schizophrenia is caused from a defect in dopamine, which is a neurotransmitter that is found in your brain, and this leads to some symptoms that we see. However, persons with a family history of mental disorders, so whether you have bipolar or schizophrenia in your family, you are more predisposed to getting schizophrenia. Also, there are some risk factors, so environmental factors such as drugs, particularly marijuana, as well as stress, can put you at risk of developing schizophrenia, especially if you have a genetic predisposition. So how to know if you have schizophrenia? So in order for you to be diagnosed with schizophrenia, you need to have at least 2 of these symptoms according to the DSM-5 criteria for over a 6-month period. So they have positive as well as negative symptoms. So the positive symptoms include your delusion. So delusions are basically fixed false beliefs that are not in keeping with the culture. So for example, you feel like you're Superman or you have superpowers, or you're watching TV and feel like the person in the TV is talking about you, or you feel like people are out to hurt you or kill you and things like that, right, without reasoning. So the next symptom is your hallucination, and hallucination is a perception disorder. So you may see things that's not there, you may hear voices in your head, you may feel things running on your body but there's nothing there, you might taste things that is not there, or you might feel something touching you when nothing is there. So these are perception disorders and we call them hallucination. There's also disorganized speech, where your talking does not sound coherent, you're using words together that are not supposed to be used together, you use new words, or it's just jumbled when you talk. That's also a symptom, as well as disorganized behavior. There are also what we call negative symptoms, and these present similar to depression. So you reduce speech, you don't want to talk to anybody, you lack motivation, you don't want to socialize, you just look blunt all the time and just flat, no emotion in your face, etc. These are also symptoms of schizophrenia, and they may be more difficult to treat. So let's now talk about treatment of schizophrenia. So it is important for you to be compliant with your medication. Take your medication all the time. It's a chronic condition and you need to stay on your medication in order to have a normal life. And yes, it is indeed possible for you to have schizophrenia and comply with your medication and have a normal life. Alright, so treatment may include medications such as antipsychotics. You have atypicals and typicals, and there are different side effects that comes with your medication. So please talk with your doctor and find out what these side effects may include for you. Depends on what medication you be on. There's also psychotherapy or talk therapy that can also help certain people, and this psychotherapy is usually used along with your medication. Alright, so that's it for this video. See you in the next one. Goodbye.